Thank you, Mr. Walls. Now, Ms. Sanchez.
Save the best for last.
That's
did you?
right. Exactly.
I'm teasing. Good morning to you all, and thank you so much for coming and testifying. I'm going to start my questioning with Ms. Ansley. In your written testimony, you note that being eligible for VR&E services doesn't automatically confer entitlement to services, and I'm curious to know if you think it should, and why or why not.
I think that, as I've mentioned earlier, employment opportunities to help people to become employed or live independently are definitely not something that we should limit. Of course, we have resource considerations, but I think if we look at the long-term aspects of people who are able to become employed, who are able to, quite frankly, become taxpayers, to contribute to society, all of the different aspects, I think that investment up front to help people to be able to do those things really nets us out in the long run, so that it's the individual maybe doesn't have to look at other programs where they would have to look for income. They're able to be more self-sufficient. So I would say that we would err on the side of including people. What could it hurt to help people train to be able to get a job?
I share those sentiments, and I know that it does take a certain commitment of personnel and resources and funding to serve all of those who would be eligible for this, but I share your opinion that in the long run, I think it would actually be more cost-effective if we did allow those who were eligible to have the services. In your written testimony, you also note that a significant number of veterans don't successfully complete their rehabilitation plans. And I'm wondering, what is the most important thing that the department can change to make sure that veterans complete those plans?
Again, something I think that we've discussed is I think we need to look at why veterans are not completing. And some of the studies that are in process or have not been completed, they've been discussed, but I don't think we have a really good handle on necessarily why it is that a veteran does or doesn't complete, does or does not hear, the various aspects of where they end up. I think we really need to look at that so that we can effectively then target those resources to make sure that we are, directly spending what we have is going to places that needs to be to get people the opportunities that they need. So I think that that's something we definitely need. We need the follow through with the studies to really get that answer.
Yeah, because it just sort of goes without saying that if you have programs in place that are meant to help people and then people aren't succeeding in those programs, you might want to go back and ask the question, why? What are the barriers, or what are the obstacles that we can try to help remove to make sure that it's a more successful program in the long run? I'm interested to know if you find any differences in completion rates between men versus women.
That's an interesting question. And one that I don't have the answer for. I'd be happy to take a look at that and get back with you for the record. I think that that's something, though, that we definitely do need to look at, the unique concerns that are, as women in the workforce have unique concerns that maybe necessarily male veterans don't have with regard to, you have an employment now, but you still need possibly childcare. You have a lot of other balls in the air that you're trying to focus on. So I'd be happy to take a look at that and get back with you. That's a very important question.
Very interested in that as a working mom myself.
Yes.
With a 2-year-old. I understand the difficulty of trying to balance. I appreciate your answers, and thank you so much. Mr. Daley, in your written testimony, in some of your oral comments, you talked about necessary evil, but you questioned the use of contractors to perform the individual one-on-one work with veterans. And I share your concerns about subcontracted employees in general, because I have my fears about whether they have the same expertise and commitment to excellence and longevity in their jobs and experience as career federal employees. I'm wondering if you could just maybe detail some of the shortcomings you see in the contracted positions.
I'm not that knowledgeable about some of the shortcomings. I was just a generality about, the VA and the professionals working with the disabled veteran is certainly a preference. I can look into that and get back to you in writing with some answers to that.
I appreciate that. Any of the other panel members maybe have some of the, maybe have an answer for what are some of the shortcomings of subcontract employees in this particular context?
I could offer, ma'am, that we know a couple of years ago, the VRE national acquisition strategy came under some criticism because the contracts that were let from central office to provide services across all regions were, so VRE could provide the same services at each particular locality that was available. Unfortunately, these performance contracts were not, services were not delivered well, nor were services managed necessarily well according to VA Office of Inspector General report of the time. One of the issues was a lack of entry of data into the systems that track contracts in the first place and how they're performing. What are the contract requirements? How's that being managed? There was some training that was provided then that VA OIG talked about, yet that training did not seem to give the results that they were seeking. Training is since being offered again as we go towards a new opportunity to provide contracts for services to veterans across the 57 regional offices. I encourage this subcommittee's oversight role in looking at that particular issue to make sure we are getting the bang for the delivery, bang for that buck we want to provide our veterans these important needs.
Thank you for your answer. That's one of the concerns I have is the oversight of how the contracts are being managed and whether or not they're performing the work adequately to help our veterans. Thank you, Mr. Chairman. I yield back.